Vaginal rejuvenation refers to basically rejuvenating the vagina, and the components of this that we usually work on are the labia, and that's the lips on the outside of the vagina. These can elongate with age or pregnancy, and for some women it can become embarrassing if it's visible through clothes or even painful during exercise. So the idea is to remove this tissue to basically reduce the labia. The second thing we can do is add fat to this area to create the puffiness of youth. This is a little less common than labiaplasty, but it's something we can combine to rejuvenate the vagina. The other thing we can do is inject the vaginal wall and clitoris with PRP, which is platelet-rich plasma. In this procedure, we draw blood, then spin it down and collect the platelet-rich plasma component. It has the platelets and all the cytokines and growth factors and those sorts of things that help our body heal when we're injured. And we inject that directly into the anterior vaginal wall, sort of where the G-spot is, theoretically, and into the clitoris. The idea of this procedure is to improve circulation and the nerve endings and all the things that will lead to more intense sexual pleasure. Surprisingly, you would think this is really painful, but it's not. The labiaplasty itself can be performed under local anesthesia, so we just put some topical on the labia and then inject it with a lidocaine and epinephrine, and then remove the tissue with virtually no pain at all. Even the PRP, one would think is very painful, but it's not. We apply topical medication to the areas we're going to inject, and also we do a nerve block. So patients will find that this is probably not very painful at all and are shockingly in no discomfort. With the labiaplasty, when we're removing tissue, it may take a couple weeks for the labia to completely heal. And so naturally, women should refrain from sex for a few weeks. With the PRP injections, there's really no downtime, and patients can resume sexual activity whenever they want.